lately, I've been seeing a rash of patients who have not been to the dentist in 10, 15, or 20 years. These are a couple of examples. They are loaded with calculus. And why have they not been to the dentist? In almost all of these cases, these patients have experienced traumatic experiences when they were younger. So if a patient has a really traumatic experience as a child, they have the fear of dentistry in their head for the rest of their life. And so they avoid going to the dentist. They avoid going to the dentist until basically they feel there is no choice. And unfortunately, in many of these cases, by the time they get to me, I can't always help them. I feel like I'm the court of last resort. I'm where the buck stops for these patients. And once in a while, they've just gone so far that we really can't do much for them. This is an incredible example. I don't have this opportunity too often. So this patient came to me in 2013. And at that time, I could have treated this patient, and I believe we could have saved these teeth. Well, the patient elected not to proceed with periodontal treatment at that time for whatever reason. So 9 years later, that's last year, the patient returned to our office and finally decided, hey, I better do something. So this is what the patient looked like in 2013. This is what the patient looked like last year. This is the progress of periodontal disease. I don't often get a chance to see this kind of situation, but the patient did come back 9 years later, finally decided he wanted treatment, and he got treatment, or is going to get treatment, but not from me. He's going to get it from the best implantologist in the state, and that's Dr. Katranj, because it's too late. He's just too late. Lower anteriors, before and after. Maxillary anteriors, before and after. Before and after. Before, after. Yeah, so it's really remarkable to see the progress of periodontal disease when it's untreated. And with the tools that we have today, especially the laser and the microscope, I just believe we can save teeth that we never could have saved before. And I love basket cases, but sometimes these patients are beyond the basket and they simply can't be saved. We use the microscope to identify the parasites and bacteria that are present. And then typically we use the laser to destroy these organisms. And then equally important, we teach the patient home care techniques to prevent recurrence. We can often stop the progress of this disease if it's not too far advanced. But if the patient doesn't know their home care, if that home care isn't sort of beaten into their brain, and that's very important, they have to do this. We make sure that they do it. I don't let that patient out of the office until I see that they are really doing what they have to do. These are some examples of some bone growth that we've seen in LANAP cases with the laser. Before, after, before, after, before, and after, before, after, before, after, before, after, before. These are LaPip cases because this can be used for implants as well as natural teeth. And these are quite remarkable. These are some truly great results that we've been able to get with the laser. And the LANAP procedure is the only procedure that has been approved for bone regeneration. Some more bones before and after. Most would consider these teeth untreatable, and I get a number of these cases where the patients have come to me and said, look, my dentist told me all of these teeth need to come out. Well, I've treated a number of these cases, and very frequently we've been able to save most of the teeth when the patient has been told that the teeth are hopeless. They're not always hopeless.
Restore your smile and your health. Visit drnemeth.com to schedule your appointment today.